Good evening, everyone, and welcome to our special conversation on understanding epilepsy, breaking the silence. I'm Josephine Garnham with Healey International Relief Foundation, and tonight we're joined by Dr. Gabriel Ofowe, who's a neurologist, Max Bangura, who's the director of Epilepsy Association of Sierra Leone, and Molly Godds, who's with the Healey International Relief Foundation. We'll be addressing one of the most misunderstood health conditions in Sierra Leone, epilepsy, with Roe Foundation, Rotary International, and the Epilepsy Association of Sierra Leone. I would like us to start first with Dr. Gabriel, if you could tell us a little bit about yourself.
And good evening to listeners at home. My name is Gabriel Ofowe. I'm a pediatric neurologist originally from Nigeria, and I've been in Sierra Leone for the last 5 years, working with during Children's Hospital. I'm a professor from the University of Benin in Benin City, Nigeria. And I'm a pediatrician and a pediatric neurologist for children. I've been practicing now for the past close to 40 years.
I am Max Bangura. I am the founder of the Epilepsy Association of Sierra Leone. That's about 2 decades and a half, since the 3rd of December in 1999. I am actually a trained social worker. I had compassion in dealing with persons living with epilepsy in this part of the world. And I've been in the struggle and challenges, seeing how to improve the quality of life of people living with epilepsy in Sierra Leone. Thank you so much.
Thank you, Max. Hi, I'm Molly. I work with Healey International Relief Foundation as the Monitoring and Evaluation Officer. I also am a social worker by training, and now I work on projects in health system strengthening, mental health, and gender empowerment.
Thank you all so much for being here. Dr. Gabriel, will start with you. Beaucoup people then they still confuse epilepsy with seizure. You go help we understand wetin are the difference.
Okay, thank you very much. Epilepsy is a type of seizure. Seizure encompasses everything, including epilepsy. All right? So there are 2 types. Let me break it down that way. Seizure can be as a result of an illness, and in children can be as a result of fever. All right, just fever. Can be as a result of infection in the brain, like when malaria don't enter the brain, or when bacteria don't enter the brain, what they call meningitis. So that type, now what they call reactive seizure. All right? So epilepsy, now be what they call seizure when not they provoked. The one I first talked before, now provocation if fever day, infection of the brain day. That is the convulsion is provoked. But epilepsy, now unprovoked seizures when they repeat from time to time in the same person. So you not get any outward illness when they make and come. So the person has the propensity, the brain will just discharge. And during that discharge, now they get the symptoms of seizures or convulsion. That's what we refer to as epilepsy.
Okay, thank you, Doc. So what I read they say is that some people then sabi this seizure like a fixed, and they call them fixed, not so.
Yeah.
So someday where they come, provoke means something the way they poke them.
Yes.
That poke can be malaria, can be bacteria, can be something where they happen to your body. Then the body they begin get like a fixed like seizure.
Yeah.
But other type day when I know the epilepsy, you don't know side they come out.
Yeah.
Not to sick don't come, not to anything. You can just cancel no more. It has for no now waiting. So that's not the next type of that's not the epilepsy we really talk about.
Exactly.
Okay. So Doc, I still want to ask you, waiting are some of the signs that you don't already explain some, but waiting are some of the signs then for me we look for make people then look for, so that as they notice and no more, then go quick na clinic on our hospital for go find doctor. Waiting people then for look for.
Okay, now two things. Number one, it's very easy to see seizures when the pikin they jog, they stretch,
Yes.
they jerk, and like jogging.
Where they jacking.
Yes, they jack in food, they jack in hand, in mouth, they charm in teeth, the eye, they roll, go back. So you go see the white of the eye for dawn. Okay? Or the eye, the two go down one side, or the head go down one side, and the pikin go the water, that is excessive salivation. All right? And that time, if they call the pikin, he need to answer you. He need to respond. Now when they talk, say, the person is unconscious or he not there aware of himself. Okay? The other type, now the one when jog not there, you need to no shake body. All right? But the pikin or the person go just stay, just they look blankly into space. When you call him, you need to respond. You know, talk until he can't aware of himself. Another subtype of that one might be say the person feel fall, not done. All right, you just dey blank. Then if he dey like that, from that position where he dey blank, if he progress to jogging. So now what they call partial to secondary generalized epilepsy. All right. So there are other types of epilepsy where they get psychic manifestation, because epilepsy or convulsion can present with motor, sensory, and psychic sensations or presentations. Those psychic, for instance, some few, these are not very common, laugh, a form of seizure, what they call gelastic seizure. Laugh, the person they fit control on. All right? There are some seizure day when the person don't know himself, but it's just the waka or they behave anyhow. If you don't understand, doctor say the person don't craze, or the person don't, if na adult to say don't take kush. But during that period, he don't know himself, he just the waka, he just the behave anyhow, he don't know himself. Okay, that's what epilepsy can present with. In a nutshell.
Thank you so much, Doc. So I don't hear you say this epilepsy they talk about, not a normal person they fall down, they begin convulse. Epilepsy you can get you tinap, you go blank self.
Yeah.
You not know yourself.
Yeah.
And you go they get seizure, but nobody know they see outward, you know they come outward.
Yeah.
Other way the way person you go they laugh, something and go fit to say like bad laugh, but it not normal. Not so person a bad thing that one day, but it just means that the person maybe they go through that epilepsy attack, that seizure, and you know nobody know go able to recognize us. So all that in different ways where the epilepsy they show.
Yes.
And then you talk about the motor one where the body they convulse, they shake. So boku ways they for make people them get for really look at how epilepsy they present, so that then go na hospital. And if they in doubt, still go na hospital, then the doctor ain't go explain to you waiting na the problem, right? Because not a one way no more you able for know the epilepsy. So when somebody act way not normal as in usual behavior, it better make them carry and go na hospital. Not
Yes.
so.
Yes. Just to summarize, the one when they jog, we can recognize.
Yes.
And when they jog, but not be all jog be epilepsy.
Yes.
You get jog, we be saying a movement problem,
Okay.
muscle problem on your own.
Like
that's
nerve
different.
problem or
Yes.
something. Yes.
But this jog, when this jog when they move your body,
Where they
But-
convulse.
yeah, when they convulse, you go to water. All right, the eyes go
They
go
roll
up,
back.
or the two go on one side.
Okay.
And when they call the person, you need the
You know the
response, you need the
response.
answer.
Okay.
Then towards the end of the convulsion, the person feels pass urine, if you wet on himself,
Okay.
go to toilet to himself.
Okay. And
That-
this not just the body they react, not to
Yes.
person or anything, not just the body they react
react.
to that.
Yes.
Okay.
And the second one, when people go miss properly, Now the one, the black stare, they
Okay.
quick notice that one.
So a person just a tin up or a sit down and he just lost in attention.
Yes.
You they see they look far. You know,
Yes.
they respond to
They
you.
respond.
Yeah, like he freeze.
Yes, like he freeze.
Okay.
And that one they lead to, if na pikin wey dey go to school,
Mm-hmm.
the grade go begin drop.
Okay.
And the parents go the worry say why this pikin no dey do well at school.
Mm-hmm.
But they let the pikin know say na the type of epilepsy and they make her you drop for school.
Okay.
So they need to come very quickly so that can be identified and treated or given
As
drugs
soon
to
as
control,
possible.
and then you go pick up again.
Okay. Thank you so much, Doc. So you dey tell me say epilepsy really na medical condition where the person they get repeated unprovoked seizures.
Yes.
And also we go talk later about the stigma and all for say this not a witchcraft and not a cause na neurological, na something where they happen at the brain.
Different.
Like the wires then where they at the brain. Where this condition you able to treat am if you go to hospital quick and early for take medication. And you don't tell me the difference between the seizure and the epilepsy, that they can different, they get different type them. Because this misunderstanding here, it can make people then afraid. And they make other people then isolated. So then they feel like they're excluded from society, they create exclusion. So Max, we go come to you. And your organization, they do very good work around epilepsy. And una they work directly with communities there and school there all over Sierra Leone. What are some of the most common misunderstanding where pan you work where you don't encounter, where you don't see pan this epilepsy work here where they do?
Thank you, Josephine. Fabuluna, thank you also for listening. Since colonial era, epilepsy is widely misunderstood in these parts of the world for being demonic, while others say, now witchman them. They say now witchcraft. And if the worst one, Josephine, now that people say now since where the forefathers go don't commit, now they can't be to the picky so they say it's transferable. How you go transfer? The forefathers go don't be bad people them. That sin day na in they can happen to the picking, so they make it a converse. And so then believe say anybody we must did pit, where that kind person they don't pit way for them. If you must, that go be one way for contract the disease. That go be one way for get the sick. Or you come into any bodily fluid. Sometimes that make people go say if person gets fixed, I go kiss her. You know go do that because not just the belief. The misunderstanding will surround them. For that reason, when person fall down inside fire, nobody know they go touch am. They go badly burn himself. Simply because they say if you touch am for rescue am, you safe go get the sick. Again, don't forget say, then people they go get water, they get for can crook, they get for can brook. Most times they make we say women are vulnerable. So when you go to the stream, water will not do for kill them. Shallow water. When they fall down there, nobody know they for pull them. And because of this misunderstanding that if I go try for pull and to rescue them from the water, it will be me on turn for get the sick. So they are left there to die. So like you ask, we get a lot of other things, but these are widely misunderstood. And for that reason, person will get epilepsy. You know, they live that kind of life we they expect. They marginalize them. Nobody no wants for them with them. Marriages are broken. The school business not the right because the teacher self no understand what they happen. And if picking for them at school, Josephine, what in the school picking that they do, then they make round circle outside Ibilidom. Then go use something one leaflet. They put on like flag, indicating say Naya James before them. So no one of us step in this region. All this now a wide misunderstanding. Where if we inherit. We inherit. We born, that's how we meet them. So the organization, they really try for see how we go debunk all this myth which they ask for.
Thank you, Max. So Also, you talk about say them picking away get epilepsy. Sometimes they get for stay in a house because if then they meet up all this waiting and this is really heartbreaking, eh? If they get for go school, for go see this kind behavior, they're not going to go school, they're not going for go school safe. Then go bully them, and even some of the adults them for fair work, or some woman that you talk about marginalized women for make them married or get a partner difficult just because of them challenges, and all this so unnecessary. So how you think say people then go begin for change this kind belief here, which you want for talk about?
Yes, Josephine. We organization and we all, this for be everybody a responsibility. Different communities for ready for see how for help. We've all for come together. Follow we push this misunderstanding. We need for change what you man call the narrative. We born, we meet them. We need for get a generation, picking them. We don't mix that kind talk. So this is why we need school awareness. Also, when they go to their school, then debunk. That is for say we push aside these beliefs. We're not to correct them. If they picking and they grab, let them know now say, this sick here, we go push them afar. Josephine, sick them be there at this country, we not there again. One day we been so challenging, they call it Jiga. They like today, Fangule. Jiga not there again. We therefore fight very hard so that epilepsy issue will be recognized. So that we need for no say, oh no, epilepsy person, now me friend. So this is why we call them, we friend them. If we do that, then we'll go to school if we not provoke them. If we do also train the teachers there, let them be knowledgeable about what thing they go on at school. Doc don't tell you clearly one common type of epilepsy called absence seizure. That one day he don't tell you clearly. Now epilepsy type where the teacher not they understand what they happen. And the picky way gets that condition, not know what they happen. If you be they count 1, 2, 3, 4, 5, now stop. After some time he can't go back. He they continue 6, 7, 8, 9, 10. So you don't even know what happened. So we also they can train the teachers then for see how to manage seizures that might occur in school. You know what? Why the teacher then they send the picking them home? Now because they don't know what to do. If you go get picking, you go for down, sometimes you don't know what to do, you go die and the teacher is afraid. So then they send them to school, home. We organization they try very hard for see how they can relate the parents to the teacher and then to the health worker. So this is why it is so fantastic that Healey Foundation don't come for train the health workers. So that the mommy go feel free for explain to the teacher the condition. Prof not been telling you it, but some people that will get epilepsy, then get what you call aura. Aura now warning sign for tell say something is about to happen, which some parents then know. And if you go, you explain to the teacher for say, if me picking one for them, sometimes they smack a leaf. Some go say if me picking one for them, sometimes go the fondle looking close. But if the teacher don't know say this picking he get epilepsy, another thing, Josephine, then pick here because then they bully them, then leg force it don't be in. But if the teacher is knowledgeable about the fact, say we not get for bully, anti-bullying for day at the place, the picking for come forward. So that while the teacher they teach, he able for pay attention. Once in a while, he will send attention. If you see James, they make sure you know that say something what happened. So now all length here we want put together the family for involved, for making sure they explain to the teacher say, me picking get epilepsy. The teacher they put on in mind and they take in contact. So the teacher also they get business for do with the health worker. So the health worker knows say if he can let me do the first aid, let me do what I get for do, but I get the contact of the parents. I must connect the parents for say you picking there. The idea of the teacher for sending us home now for stop.
Yes.
The teacher for sending them to the facility. The facility for remind. So there is something triangular. And then the picking we put on at the center. We go able to do something.
Yeah. Thank you so much, Max. That is really important. because what you want for tell people then say, where they say early signs day, where if the pikin day before and people they know, the teachers they know, people they know, you go able immediately start for no.
Correct.
Say, oh, this why they can't get seizure. So where they work and train the teachers there or the community members there so that they go help her even before it for done or if it for done, make sure say then take care of her safely and off you can't talk about that. We go make sure say once that time don't pass, it will come back and sit down and continue in work or in school work. So also they try for tell people them is that law we find ways for law we be more supportive than we they afraid or we they create more trauma to people them. So now that's what they try for talk about. So so one thing we know where we hear doc is that so much misunderstanding there about this. And Max, what you don't say, the data they show say some research where people they don't do say 48% of pikin them they miss school we get epilepsy. 48%, that's not big number though. So even what they do this connection between the CHW, the teacher and the parents, I think the most important, right, if the pikin there or the people and they're on medication, sometimes the seizure go either stop or it reduce, not so. So that early detection, the way they talk about, tell we about a little bit about that. Why it's so important? Because that can even minimize the whole process there. So it not go happen that often. So the pikin then go able go school, would I get for go work, would I get for go na farm, go na farm and all. How what's not some of the things that we think say people therefore know in terms of early detection?
Okay. The early detection, because we know we won't say person get the epilepsy. A normal person, nothing there wrong with them. So no need to demonize the person. I will need to also relate to the person as a normal person. So the person should still continue to function in the society as a normal person. Now the reason we want early detection and treatment, because if this epilepsy they occur frequently without treatment, it affects the brain cells. Because the more epilepsy they occur, the more brain cells they die, they go. So we don't want that one, because we want, even with epilepsy, you can become a professor. I know of doctors, medical doctors, won't be epilepsy. Won't get epilepsy. All right? So when you take the drug, we can control epilepsy, prevent it from happening, and then the person can continue his business. The child can go to school, graduate from university, do whatever profession he wants to do, but must be on treatment. Okay? The adult can go to work and then do whatever business he wants to do. There are certain things we need to educate both the patient and the mother about. Because Max made mention of water, fire, soup, cooking, and all those things. So when we come to comprehensive care or treatment, it's not just to give medicine. And there's a no. All right? So there are certain things we do in the clinic when you come. When we are giving you the drug, we must educate the caregiver, the mother, and if the child is old enough, we must talk to the child so that the child will also know the problems he has. The mother knows. And if it is possible to go to the school, yes, there should be a situation, like you said, linked with the school. Normally, any child that has such issues, the school should be aware. There's what we call school health program. These are the things that should be dealt with under the school health program. And the school health program, because most schools are supposed to have a sick bay. And the sick bay is supposed to be manned by maybe a nurse or a community health officer, or you understand? Who can understand basic first aid, basic treatment. A child has fever, you give paracetamol. All right? A child has epilepsy, just has a seizures, you know how to administer the first aid, make the patient rest, tidy up the patient before the parents come. those kind of things. So school health program is also very important. If we had the proper school health program, and each of these schools that are functioning have a point where we can interact with, then we just train the person in charge of the school health program who is to now educate the rest of the school and the students. When they see a child convulsing, they are not afraid. They don't run away. They understand and they can provide help. So those things that are not there, maybe if they're there, we can do something.
Doc, this not very important thing what you don't say. So what you are the area they say, this what they talk about 48% of children, and even we get other numbers of adults and all. You they say this na normal people then. We need for no say this na normal people then. The seizures, the epilepsy, not they define that person the ability and all.
No.
This na person if they're on medication, if they know what for do, if they know how for manage then seizures and that person they go school. Till he go finish college, he get in degree, he get in career. If na person we get for go work, he go work, not a problem. Just people need for no for say. These are normal people waking just this break, this gap. But if you're not there on medication, you they say that seizure they now they create the problem where they cause the patient now for begin get the psychosis and the mental. But if they catch an early, all that then go avoid. And if they do certain things for keep the patient safe, meaning they not go other side past the hospital and the clinic. For go.
Yes.
And this the school health program, it look like saying something we go require some advocacy from you, Max, so that we go advocate for low get more school nurses then people we go know and they now go educate the teachers, educate the schools, and then go na the community, not to so doctor.
Yes. Normally before a school is approved, before the ministry approves it, there must be some arrangement where you must take care of health issues because any emergency can occur in school at any time. All right. So, but apart from just taking care of first aid, school health program has about 8 components, and I think Sierra Leone has a national school health program and the components. All right, because before the child enters school, you need to assess the child and identify all the disabilities when the child get. Like the child they feel see far, the child they feel talk, or the child gets some issues, we need to identify so that you can advise the parents that you have identified this in this child and this is the best way to go for it, or you need to see a specialist. All right. Then apart from that, school feeding program is part of school health. Physical education and exercise is part of school health. Health education is part of school health because you need to teach the child. If the child know how to behave, how to prevent diseases, as they grow up, he himself will prevent diseases. You understand? So there are other components. And then the community is supposed to participate in that school health. It's because it's supposed to be their own product that's supposed to participate. You understand? So if we bring people together, all together, then we can sort a lot of things. This epilepsy, we can deal with it, like what we're trying to do here now, you know. But I must quickly say, epilepsy can also occur with other diseases, especially in children. Those diseases they're on their own that can make the child have handicap. Okay. And then they can't get epilepsy on top. While we can control the epilepsy, we also manage the condition that is handicapping the child, like cerebral palsy, for instance. You know, and there's what we call attention deficit hyperactivity disorder, where the child is hyperactive, impulsive, does not pay attention. That's a different developmental entity, but epilepsy can coexist with it. You know, so but once we're able to control the seizures, the epilepsy, then we can pay attention to other secondary.
Oh, that is so important, Doc. Doc, I'm so glad that you don't mention that the community systems matter. Not a hospital, one grain no more for do this. Not to the one grain for the community need for their part of this.
Exactly.
So now make Molly, I want to turn to you. And Molly, I will talk in English to you. I will translate for now. Molly, from your experience, what role do community health workers play in epilepsy care?
Yeah, community health workers are really important in epilepsy treatment because they already have the trust of the community that they work within. And that's important for making sure the individual gets access to medical treatment, but also for addressing all of those community systems that surround a patient and provide support. So, on the individual level, as has been mentioned, there's a lot of stigma related to epilepsy. A trusted community health worker can help navigate that, maybe screen for symptoms and recommend care, and might have better luck because of that trust and that existing relationship in the community. But then those broader community systems are really important for ensuring social integration, access to resources, school attendance, and a community health worker will understand those systems that are in place. So they might know the principal of the school or a teacher and be able to navigate those conversations, bringing the medical information in, but also navigating the social relationships, where they might be able to work with the family in a home visit and talk about those safety precautions and seizure first aid. So community health workers can do those home-based visits, work with the whole family, and also understand where there might be more needs a person has. So by working with the person in their community, they can see if someone has other unmet needs, like education or maybe employment or housing or something else that's impacting the patient, and maybe preventing them from getting adequate care, and can work with resources in the community to make connections. And part of that too is providing mental health and psychosocial support. So a community health worker, when properly trained, can be that trusted person to provide mental health first aid or psychosocial support to the individual. And lastly, with the medication treatment, we know that continuous access to medication and maintenance of medication is really important for treatment. So something community health workers can really effectively do is follow up with a patient and make sure that they have continued access to their medication was provided, that they're taking it daily to prevent more seizures, that it's working effectively. But that really has to be done, through maybe home-based visits or regular care that a community health worker's well suited to do. So all those things are things that really need to be done by someone in the community who can be visiting the person and talking to the community members.
Thank you so much, Molly. So wetin Molly they say is then community health workers what they talk about them really, really important for we. Now then are the people then where they trust na the community. Then set na from the communities then where they know the community, they don't build trust, people they know them, they sabi them. So if you train them properly, now then go able for recognize and teach people then how for recognizing seizures them, how for deal with the seizure when it come, then go do first aid, like mental health first aid, then go teach the families then go even give that to the communities then, to the people then where they get the seizures, teach the families how then self for they sensitize them. I think we all know that word they then go provide then go educate the families then go refer the patients then to clinics then, but then go also help for find out whether the patient then they take the medication, if gap day, if they need medication, who side them for go get medication. But then community health workers then, if they train them back well, then go able for look for other things then back na the community. Like for example, if a person they will not get housing, for look for housing, for look for work, for picking them, for make sure say picking them they go school. So all that day they really get the community health workers and where then go support, then go correct waiting at the misunderstanding, waiting at the correct information about epilepsy and waiting at the misunderstanding about epilepsy. And really then they for support the families then emotionally, support them for link them to the care, support them for link them to the school, and ensure say the community then they hold them people then like their own. They go treat them well so that they can become productive and fully integrated people in the community. So Dr. Gabriel, you go agree say then stage W then critical, Molly mentioned mental health and epilepsy support. You go talk a little bit more why it's so important that we train them community health workers there, how we they incorporate mental health first aid, how that they link, why it's important. And you be don't talk in the beginning about how the seizures and when they can too much, then they create some psychosis. You go explain a little bit more, make people they understand waiting they happen, that they get the psychosis immediately in most of the cases then. Why a person they get epilepsy for a long time? You go ever explain that small bit?
Yes, okay, fine. When epilepsy they occur frequently, it burns some of the neurons when they're in the brain, and you need the neurons to function. Okay, so eventually the person will lose what we call cognitive intelligence or cognitive function. Like person when no book or no. You go down the social strata, let me put it that way. All right? Now, the mental health problem when epilepsy they get, because epilepsy doesn't cause direct mental health problem or psychosis. It doesn't cause direct. All right? But when they cause them, we say, number one, for children, all right, once you treat them, they are not allowed to be, mix with their peers. You isolate them, all right? And adult, because of stigmatization, all right, it causes depression, and depression is a mental health issue. Okay, then a parent or caregiver dealing with a child that has epilepsy. Now, if you look at most of my patients, they say one of the reasons they say is that they shame for come public with the child. So they keep the child like host, inside host, when they come out. Okay? And for instance, they need to go na market, or they need to go na mosque, or they need to go na church with the Pekin, because they're afraid say if you fall from there, they will disgrace themselves. And that's also they try the Pekin. So this is gradual isolation, and then the caregivers, now have depression. They have guilt, sense of guilt, because they do not understand how the basis for the epilepsy, and they have burnout. Called the burnout. Then two, managing the patient, getting drugs is a Herculean task in Freetown. It's not. Sometimes some drugs go come, you go see them, then other time you don't finish, and that is very bad for treatment. Because we really like to start drug when the person not go fit continue. Because if he take drug, you don't start to take medicine to control her. If he stop, the epilepsy will go strong.
You're stronger.
So community health extension workers are very important. Number one, because first of all, we not get that many doctors, so you go everywhere. Even if we get Boku doctors, they go to the hinterlands, up country then. Places where yes. So we need a group of health professionals that we can train, that we understand, that can pick up the children and then advise appropriately. Then when we don't finish, the ones who don't come to the hospital, come meet we, I will not finish with them. Okay, take this medicine. They can go back to the community. The community worker can begin to follow that treatment. And if there's any problem, it's okay, you cannot go to your doctor to follow up on this and that. Because, we need that linkage. All right? And we need them to also educate and support the families and the patients in the community. Like Molly said, now, person they don't trust, they know for the community. They don't trust them. Within their talk, they could believe. All right? And so we also need them to also pull the people in the community along, particularly the decision makers. The religious leaders, the political leaders. Which other leaders they get together? Traditional leaders. To pull them together, once they know that, okay, this person can be trusted with this kind of issues, of course, they'll get their people to follow.
Even like the police, the other one, they're all within the.
Yes.
Okay.
a very important group of
So the community
people.
health workers waiting at the area, they say they're not just not for the patients no more. Then at the bridge between the patient, the families, and the health system, but also to the community. Now that they help for make the community really
Exactly.
support this program, become and say, okay,
Exactly.
this now we people and we support them. Now this now the low understand waiting at the issue and low work together. So the community health workers are very critical for this process here. So Max, I will come back to you. You they work extensively in schools and boku schools then. Why early education on epilepsy is so important for this country? Yeah?
Thank you again, Josephine. A very important, like I said just now, we need for change the narrative. We need really for change. You see, picking there, it's quite simple. It's easier for send picking there with messages. Sometimes you go say, Lord, send message via the media. But if somebody no be don't open it already. But like picking, one side they train 500 picking there. How about epilepsy issues? Say if somebody for don't have to go to hospital, they will send this 500 message to other siblings, to their parents. So the message they go far and wide. So it's quite important also for Lord no say, picking them, then they disseminate information very fast. And when did they talk just now about the 48% way we do? 2011, now we do that 48%. Remember saying that a small group we just get, we Professor Lisk, we get in a Connaught Hospital. For what we do, those questionnaires to administer, we will get 48% of the picking away. You say, you go school? No, you not go school. So now so we cannot forget the 48%. So remember no more how many picking them day we know nothing about epilepsy. And now then picking away the parents sometimes can discourage. So the picking them to be the vital, they're very, very important because seriously we want change. I kept emphasizing with the change the narrative, Josephine. We meet this talk. People could be professors today, if not like professor here, we're a medical professor. There are professors from other universities, if you ask them, now then go ask you if epilepsy is contagious. Because not to the area. That way we don't get centuries, years ago, say epilepsy, they say it's transfer. It's still there in them. We need to change the mindset. And we use the picking as we paddy them for help we disseminate the message. I will tell you something. One time when they go to schools there, they say, we want for so that the helpline, we not the need for go radio. But if you meet somebody gets seizure, not forget this number. We made it a song. 088 555 33. Before we come on at the place, we don't come out there. The other day we heard it. As they see me at the song, then they sing. So I turn to song.
Yes.
So to we is important.
Yes.
Because they do with their mind.
Yes, absolutely.
Now their mind really they work with. Not on nothing next. So yes, we're really ready for work on the beginning.
So that's really powerful because we say the acceptance and then utilizing the picking for make them go faster information there to the communities is very important as well. So Molly, I will ask you and then Una all can answer in terms of waiting at some of the wrong treatment and way. Molly, what are some of the treatments you've read about, you've researched about doing your work around Sierra Leone that are really bad and dangerous for people living with epilepsy? What are some of those that you've learned about recently, and then we'll pass it on? Because as you see, as you're in the community and doc, when you have patients that come to you as well. So we'll start with Molly.
Yeah, so a lot of people do go to traditional healers as a first source of support because they are often trusted community members and have that relationship. So some of the initial treatments learned a lot about from Max about, but include like herbal remedies that you drink, but sometimes can be toxic or cause other health conditions, including sometimes things like kerosene or things that cause a lot of problems when you drink them. Or as Max was mentioning, inhaling steam from herbs might not be, even if it's not actively harmful, we know it wouldn't be addressing the medical causes of epilepsy, but often would be an initial response to treat the epilepsy.
Yeah, fantastic. To me, the mistreatment, there is an outcome behind the misunderstanding, say, epilepsy na sequence transfer. This word is just too rampant in this country.
So, Max, before you continue,
Yes.
one say, first of all, to all them one that they hear we then they watch we. Epilepsy not they transfer from one person
Yes.
to the other, right, doctor? Not to
Correct.
something where you go eat pan spoon, person eat pan spoon, you get them. Not to something where you sit down pan toilet, all the person sit down pan toilet, you go get them. Not to something if you hug or touch person where we as human beings, we need touch, we need hug, we need for feel say we belong to the community. We mama love we papa love we paddy them leg for whole we in a safe way. You know they transfer. Epilepsy they transfer that way. They continue, man.
Just for you, just done a fantastic job. This message for go. Family members, we for not say this misunderstanding. Josephine, you dey go to university, you get your degree, but when you are not employed. People who get epilepsy are disproportionately disadvantaged in the job market. They don't employ you. We get case the way we dey fight because you go for down a workplace. Oh no, come on, you don't be tell me you get the sick. No kind again. Until we begin writing bring police business. We get those way, then they go, then they end up in a police. So you write that we also need a stakeholder, the police therefore did it. Why somebody go can it provoke who has epilepsy? And then I don't know if they tell you some people and they pick it and the way they work, then the worker will stone them. Just feel that actually the worker was stone, not supposed to be hate not there. But the picking there was he had not it. Forget to say now they provoke him. And so the worker was stone. And when you begin call her names, he pull
For
stone
protecting
and begin
self.
stone you, they kept laughing. So we organization they stand against that. This is why we they push on policies we go able for arrest the kind of people in there. So we get for work with the police. So to me, the misunderstanding say epilepsy they transfer. Now it don't cause broken marriages. Sometimes when the whole workshop we can ask participants them. Woman or man or if one person get epilepsy, without the left in copy. You very demanded. Now the woman there. The woman that they say, now the man there. But frankly speaking, women are vulnerable.
Yeah.
They go left you with you picking them. One time we go Kaila home for go give medicine or talk. You know, before that person then bring and come to the health facility we been did. He don't for they don't badly burn himself. Where we can ask, a man don't left a long say. They left out there two picking there. And what it be happen? It been die. So the misunderstanding say it they transfer. Now you don't make today picking them. They know they go to school. Professor just taught that point judges know. That there are some parents when they all them picking them, no go out again. No. Then they scroll them picking her in secrecy. Not so that, well, yes, we get parents them back where they overprotect them picking them. If I allow me picking, he go out, he go for down day. Nobody not get for help because they misunderstand her. And they get for be ashamed to me we born up. So to me, the key points there, what would they try for? Push a fire. Because Josephine, if I have no say me epilepsy, I keep me first aid simple. I know waiting for the when I see picking for them. I don't misunderstand at all. I know say I'm a friend. I hug them, like you said. I direct them for treatment. Because Prof not just reach that point because you get too much for say. But even when person miss medication, it can trigger up the seizure. But if now your friend, you go ask her, you they take the medicine? So we go be only compassionate if we accept say the sickness the transfer. To me,
Yes.
not the main thing.
Thank you so much. Doc, I sure say you they see beaucoup patients they count different stories, different really sad, sometimes very late after they don't try all things and they come to you. They don't go through a lot of trauma. You can explain some of this story and then after I'll go ask you what a person can do if they see somebody they get seizure. But first maybe some of the examples of some of the really harsh treatments whether you don't see some of your patients there so go make people they go stop before they do that.
Okay, first of all, from misconception or misunderstanding, because most people think that epilepsy is a devil's disease. They believe that in children, the children convulse when the demon or the evil spirit appear to the child. And the child cannot see anything but begins to convulse or seize. They believe that. And that is the reason why they put mark on the face
Then it got
and the forehead and rub some things in it. Because they believe that once they put those marks on the face, if the spirit comes and sees that mark, it will go away. That is completely wrong. Apart from the cutting, they also have the wear these a lot of charms. That charm will ward off the evil spirit. It is wrong. It is not correct at all. Then, when a child is seizing, for instance, a mother now, because they think that it's a near death, it can kill. When the child is seizing and is clenching the teeth, they think that the child is dying, the child is not going to breathe. So, because of that misconception, they try to force something into the mouth to make sure the child does not clench the teeth. In the process of doing that, they injure the child. Or sometimes they don't want the child to bite the tongue. So they have to put a spoon or a stick or a metal to separate the teeth. So that is wrong treatment. Then, of course, in Africa, we have reasons for what we believe and what we do. Okay? Now, like scent leaf, I don't know if you have scent leaf in Sierra Leone. All right? When the child is seizing, they want to put something that is pungent. To make the child, to make the child sneeze. Because they think that when the child sneeze, then the child will come around. All right? Yes, true. A pungent smell will make somebody sneeze, but that is somebody who is conscious, who is aware of himself. But the child who is having convulsions will not respond because the brain is not, person is not aware of himself. So these are some of the things that people have used. In my practice too, we have seen people use, petroleum products, crude oil, kerosene. They drink, not only drink, they also rub on the skin. We have also seen people who also force.
Doc, can you talk a little bit about the danger of ingesting things like kerosene, engine oil, how dangerous that is, first of all? If you could talk a little bit about that as well as you identify some of these things.
Okay. Now, kerosene, diesel, crude oil, engine oil, all these are organic compounds. Organic in the sense that they can penetrate skin.
Chemicals.
Yes, they can penetrate the skin. When they penetrate the skin, they enter the bloodstream, they can go to the brain. The brain is very sensitive to these kind of chemicals and it can destroy the brain further. Now, drinking kerosene is very volatile. All right? That's why we will call it kerosene poisoning. I mean, children accidentally drink kerosene. We call that a poisoning. So now we talk about saying you won't give her as treatment.
So kerosene in itself,
Is
Poison.
Yeah. So nobody not supposed to drink kerosene in the first place.
In the first place.
Yes.
Not supposed to drink kerosene.
Neither petrol nor
nothing.
engine oil. None of these things.
Yes.
Actually, they can cause more damage to the person.
More damage, like kerosene, is volatile and is a very light fluid. When they drink them, it enters the lungs.
System fast,
Lungs, because it flows into the lungs and cause chemical pneumonia. So now they add to the patient problem. Not the epilepsy now, they destroy the lungs and now they destroy the brain. If they rub for skin, they also damage the skin. So all these things, no need for use them at all. It's a very simple thing. They apply the correct drugs, person is controlled. The problem we have is we do not have the drugs.
Yes.
That's just all. If we have the drugs, we apply the drugs, we can control epilepsy. You wouldn't even know that the person has epilepsy.
So, but doc, if centers then we get access to the medication, and now we get in community health workers, we go meet the people and say, go na this clinic or this hospital, make doctor see you when you take medication. If they take the medication, who side the medication dey? Most likely the seizures go reduce, or sometimes it can even stop, as long as they stay on the medication they take and well, not so.
Yes, most of the time it will stop.
So medication dey when they in a hospital, when they go off the hospital, then get medication. So they do two things. We go try for make we get access to the medicines then for then at the hospital then and the clinics, and then we need make people then go na the hospital and the clinics and for take the medication.
So take the medication, yeah.
So doc, you don't talk about some of the really dangerous things and way people they do when they see person they get a seizure. Wetin na the thing where them for do? Not waiting them, we don't hear it waiting them not for do, but then they do. Waiting are the right things that we them for do if they see somebody where they get the seizure.
Okay, very good. Thank you very much. Now, if somebody for done, they get the seizure, get the jog. First thing, first aid. Lie him down on his side, on the left side. All right. Make sure the face they flat and the neck not buckle or not to extend. So that if water they come up for the mouth, it could flow out. If anything they tight around the neck, lose out. If you wear tie, remove the tie. If the button they remove button. So losing things around the neck and leave the patient there. When the seizure don't stop, you can go stand up, because the person will stand up. So no need to attempt any heroic things. Okay, just lie the person on the left side, make sure the person is breathing fine, remove any tight fitting clothes on the child, nothing is obstructing the breathing on the neck, and just allow the person seize and stop. And then there's no dangerous materials around the person.
So doc, wetin dey hear you dey say, first of all, make people around stay calm, right? And then make them turn the person on the left side and make sure say then head dey flat, and that the neck, then chin not dey down or they too up, so that if then they get water they come on at their mouth, the water go able come on, no go choke them, no go choke them and go either na their nose or back inside their throat. And then you they say make them remove any, like if table, chairs or stone then they around, make them remove them carefully. So if the person they get the seizure, you no go jam them or hit in head or something. And then make them not put nothing at the person in mouth. You not need anything for that. The seizure will come and go. But if they get tight clothes, tight like necktie or something tight, make you loosen them but help them small bit. And then of course if the seizure lasts past 5 minutes, make them seek medical help.
Yes.
If the seizure not pass quick, then for seek medical help.
Yes. Normally, the seizure within 5 minutes they don't calm down. All right. But if it pass 5 minutes, then arrange to take the person go to a hospital so that we can stop it. Okay. So if we don't know say the person get epilepsy, all right, it is seized. Normally, within 5 minutes, it will calm down. It will stop. All right, they ask what they do it in drops and so on and so forth. But if it past 5 minutes now we call status epilepticus. You don't go into medical emergency.
Okay.
Yeah.
Thank you, doc. So I know we can wrap up now, small, but something that way you mentioned, wait, doc, I want me to touch on them quick, and maybe we'll go get another segment specifically for this. But you mentioned in the beginning of our conversation something around kush. I don't know if now you or Max talk, and now we get this issue with people and when they get kush. And some of the symptoms them, people they can mistake them where person gets a seizure. Then they mistake them, and sometimes then people then they ostracize and then go hamburg them. Then fetus and people they take kush. How we go able for support with patients then when they get epilepsy for make sure say people go treat them well, they no go say, oh, this na somebody when a drug addict. Wetin are some of the things, wetin are the advice you wan give? Maybe go just do that. How for make sure say law not confuse that not to for say when you see somebody they get seizure or get epilepsy, even if somebody tinapi they stare out, you know, then go say, oh, that is something a drug they pan where it can be maybe a seizure they happen, but you know they convulse, it just get that internal seizure when you know they show. How we go able for talk to the community about that as well, so they not go stigmatize the person.
Yes, first of all, the community really don't understand. Now, as with the train community health workers now, they talk to them, they don't understand. All right, in the absence of that, call the hospital, discuss with your healthcare worker. Look, we don't understand this thing that happened. Then we'll go interact, examine the person, and get to the bottom of the issue. I'll give a story. There was one of my patients, you know, the caregiver, you know, the woman not there, but another woman there with the papa. They say he dey lie. They say he dey go take meat in a pot for night. They say he dey waka Sunday, go waka comot, go lost. For 2 days, they dey look for am. They say another person go see am, they bring am can't na home. You understand? So when they bring her come see me, you know, he no be like person wey dey, of course, from my training, we don't know what to go on. But at the time we do the test, EEG, we don't say na seizure. So all those one for days, when they waka comot, they misbehave, they pick things for dustbin, they chop things anyhow. All that thing wey they do,
Na seizure.
na seizure. I be get. So when I tell the mother, we start on treatment, all things stop. So, not to all behavior wey not dey normal, might be due to kush. All right. So it depends on the setting, the family setting. If they are honest to themselves, they will know. Because those when they take kush, they go no.
Yes.
You know, they'll not say this one a kush, now you cause am. But like for children, when not they take kush, they begin have problems with behavior when not normal. First thing, come to the hospital, we resolve the diagnosis, and the educator tell you what to do. You know, for adults, that's why they go to psychiatric hospital, for instance, for adults. There they can identify that okay, this is convulsion, or this is as a result of drug-induced behavioral problems. You know.
Thank you so much, Doc. We got beaucoup thing for talk about, but we're not able to talk all today. So as we dey close this session, I want for tell una thank you, and I want for ask una just for share one message for the people and whether they watch we or they hear we today. Just one message from una. I go start with Molly. Just one message that you want the people to take away today after this conversation. Like a call to action, something, yeah.
Yeah, for epilepsy, the community supports are really important for making sure that person is integrated in their community and supported. So thinking about this not just as a medical condition that needs treatment, but something that needs support from all the systems around a person is really important.
Yeah, thank you. My message for we people simple. Epilepsy not a secret, it's as far. So anybody we gets who that you know self, we get epilepsy, now your friend, come closer, all will be well. No say anytime you make policy, smile self, that also is medicinal. You don't get a medicine, we're not to pass tablet. So let we encourage those with epilepsy because not a secret it's as well.
Very simple. Do not stigmatize patients with epilepsy. Don't stigmatize them. Don't laugh at them. They make them feel bad. Instead, support, understand the disease. They are normal human beings as well. And they can live a normal life. All right. I also want to let the community know that children with epilepsies, with convulsions can be referred to me in Oloduri Children's Hospital or Julius Maada Bio Pediatric Center of Excellence, where I run the clinic. And then, of course, we can provide EEG services free of charge. And then give them drugs. All right? Free free of charge.
What days?
Usually the clinic runs on Mondays, and then we do EEG on Wednesdays and Thursdays. Everything free of charge, supported by our partners and friends. So you don't need to spend money, you don't need to
It's free.
afraid. It's free. I know Africans, when something free, we don't like them. Now when something don't cost, now they say they better, or when something they smell, now they say they better treatment, not the soup. All right, this one are free. Okay, so come and let we help you.
Thank you, Doc. David, thank you, Max. Thank you, Molly. We people with epilepsy, then deserve dignity. Then deserve forget education. And then deserve forget opportunities then. Let we replace this afraid with understanding, and let us support them like communities. Let we help them, because epilepsy, you able to treat them. With the right medication, with the right support. Person wey get epilepsy na normal person. You can go school, you get work, you able do everything where you as a normal person able for do. If you get the community support and the access to the medicines them, and the support for me they take the medicine, and for me they safe if way they get the seizures them. Epilepsy not to cause so. Epilepsy not a death sentence. Na medical condition, and together, if we educate with people them, if we love with people them, if we care for we communities then, if we get small compassion, or beaucoup compassion say better. If we get compassion, we go break this stigma, yeah? And we go able for get even a more thriving community. So me na Josephine Ganem, I dey with Healey International Relief Foundation. This project what they do, will tell the Roe Foundation, thank you. We they tell the Rotary International, thank you. We they tell Dr. Gabriel, thank you.
Thank you.
And Dr. Gabriel said they with Olajuwon Hospital, and they also work na the Mother Bio Children's Hospital. We they tell Max, thank you for the work where they do. They with Epilepsy Association of Sierra Leone. And Molly, we thank you. You said they with me na Healey International Relief Foundation. But most of all, we they tell una where they take the time for sit down today and listen to we. Una we don't hear we don't understand what they say, and una where they go now in our communities and share this information and be the compassionate ambassadors. We go make the change we want for in our community. We tell una thank you for today. And we also want for tell Banese Hope Foundation. We don't allow we for law we do this small video. Thank you. Una good night. Una thank you.